Hey guys, Nate here. So the other week we talked about different treatment classifications on low back pain and how if you categorize yourself into one of those categories, you may be needing different treatments for low back pain. So it's not, to treat it, it's not a one size fits all prescription. So I want to talk about a little bit this week about the movement category. So if you're one of the people that maybe you're just kind of stiff in general, so if you look at your hip rotation, it's a little off. If you look at your ankle dorsiflexion, it's a little off. If you look at your upper back, it's a little off. And you don't necessarily fit into the other classification systems as far as a manipulation, so you don't necessarily need a pop. Stabilization, you're not super loose, and you don't have stuff going down your legs, so you're no radiating pain down past your knee. Then you probably fit into a general movement categorization, which means we just need to improve your movement. So I want to show you a few things that you can try to start to work on to see if this may help your low back pain throughout the day. Okay? So the first thing I always like to start with is a little bit of soft tissue mobilization. So loosen up the soft tissue, loosen up the muscles so that you are able to gain the range of motion that you started with. So a lot of times that I see, a lot of places that I see for back pain is that glute. So the back side of your hip is what a lot of people get tight on them. So we're going to start with a little bit of soft tissue mobilization on the glute. So what I'm going to have you do is you can grab a med ball, or you can even use like a basketball or a foam roller, but just something with some surface area that you can put your back side of your hip on. So what you're going to do is just kind of come back and see if you can find a trigger point, which is just a tender point on the back side of the hip. Kind of work all the way up and to the side and see if you can find a spot. Once you find a spot, we're going to do a few things. So one thing we're going to do, we want to work through the full range of motion. So completely contract the muscle and then completely relax the muscle to gain the full benefit of this soft tissue. So you're going to extend your leg and then bring it out to the side once you get that ball on a trigger point, and you're just coming back and forth. You're going to do this for about 10 times, and then put your ankle on your other knee and then move your knee close to your other shoulder and then back down. And again, you're going to do that about 10 times and see if you can find another trigger point, and then keep that ball there and then bring your knee back and forth. You can do that 10 times as well. Okay? So you're going to go try to find about 2 or 3 trigger points and then move your leg about 10 times each time you find a trigger point. Okay? So from there, once you get that tissue nice and loose where it can kind of start moving around a little bit more, we need to stretch it. So a great way to stretch the backside of the hip, the glute, and to get a little bit of upper back with it, I'll show you this a couple of ways, is to go into this hip 90-90 position. And then, so this is going to be my right hip. My left leg is going to be back and it's going to be extended so that it's in straight line with my upper back. This right hand is in line with that knee, okay? So from here, my left hand is going to go palm up and go underneath my other hand, my right hand, and I'm going to turn my shoulders that way a little bit, and then just rock forward to bring my left shoulder to my right knee. What you're going to feel, guys, is a big stretch in that back of the hip, and it may even come down the leg a little bit, which is okay. So we're going to hang out here. I'm going to come down, and then you're just going to relax here. Hold it for a breath, and then come back up. And you're going to repeat that 10 times. So come back down and come back up. So if you're looking at it straight on, my hips are 90-90, so this hip is extended, this knee is bent to 90, and the knees are at 90 degrees as well. I'm going to reach back, elbows are straight, and your shoulder just comes down to your knee. Okay? So that's going to be, you're going to do that 10 total times. Okay, so once we get the movement of the hip in line, we're going to want to start to program a motor control exercise, which just means we're teaching the body how to use that new range of motion that we just got from the stretch or the soft tissue. Okay, so where I like to start is going to be on the ground. So my back is on the ground, and I'm going to show you 2 different variations of this. So first one's going to be both legs are straight, and I want to slide that same hip out to the side and try to keep this knee completely down on the ground. So you're going to come down here and then slide it forward, and you're pushing that knee on the ground as long as you can as it comes up. What you're going to notice is this other hip is going to want to slide over this way to try to compensate for that movement. Make sure you keep this other side hip down and then this knee down on the ground as long as possible. And you're just going to perform about 10 of those. Now, if you notice this in your back, that you're still feeling it a little bit in your back, what you can do is bend this other knee up, and that's going to limit the amount of back being used. Big thing here, though, is a little harder to keep that hip down. Just make sure that hip stays down as you slide this knee out to the side. But you're going to notice you're not going to get as much back involved. Okay? Again, do about 10 of those. And if you're looking from a forward angle here, you're just going to be, legs are straight, and then you're going to slide that knee out to the side. Okay? So from there, what I'll have you do is we want to work a little bit on getting that hip mobility and ankle mobility involved. So what I'm going to have you do is grab a kettlebell, and what I really like to do for low back is put this kettlebell in the front here, and then bring, so your setup is going to be this knee down, this hip up about a 45-degree angle. Initially, we're going to start with the foot close, because what we're going to do is shift our weight forward, but notice I'm pushing my knee forward and my chest is staying tall. I don't want you to lean forward. What you're going to notice is with this kettlebell, it adds a lot more work to my upper back to be used. But if I'm just using here, then my hip and my ankle is being used. So you're going to rock a few times like this with the ankle close, and then you're going to go wide, and what you're going to notice is it's going to be more of a hip movement. And we're starting to teach our body how to use that movement with the kettlebell here, okay? So you're gonna go about 5 times close, then 5 times away, all right? And then you can repeat on the other side. And then the other one, another exercise that I really enjoy to get hip mobility is find a wall or find a table where you can go on one knee, and I'm really gonna push my knee out into the table. So I'm down the line here. My knee is gonna you can kind of see I'm pushing so much that this table is moving a little bit. If you use a wall, it'll be even better, okay? So on one knee, knees being pushed in, your arms are gonna be out. I wanna push, notice the table is moving, push my knee out into the wall or table, and I'm just gonna rotate away. Notice my knee's not leaving that table. That's getting a lot of rotation and a lot of stability through these hips. I'll rotate, big deep breath in, out, rotate a little bit farther, and then come back. Relax that knee a little bit, and then you're gonna repeat. So push that knee out, rotate through, big deep breath, rotate a little bit farther. Not losing contact with that knee on the wall and knee on the table. Okay, guys? So those are some of the exercises that you can do to see if you can improve any mobility in the hips, and you get a little bit of upper back and you get a little ankle mobility with that as well. Give those a try and see if your low back feels a little bit better. You may notice that your hips are moving a little bit better and there's less stress on your low back, okay? Give those a try, guys, and let me know what you think, all right? Thanks, guys.